screen here. There we go. Let me introduce to you Patrick Phillips. Patrick is our CEO and founder of American Business Systems, and Patrick's written a couple of books. The one on the left-hand side you see is How to Reprogram Yourself for Success, which is a great book because it basically talks about the financial ceiling, mental ceiling that we get in our lives, thinking that we can't make any more than a certain amount. So that's a great book to help you through that. And then the book on the right is Cash Crunch to Cash Flow, which he co-authored with a CPA friend of his. That's more in line of a marketing piece for you as a brand new licensee. Also want to let you know about our software. We are one of the only software that we have currently on as our platform that is both the medical billing platform, the EHR, or electronic health records, or electronic medical records as some might know of, and our clearinghouse all together. So we'll be talking much more about that, but if you want to find out more about it through our website, you can join us here at absystems.com, and you're going to want to go through our website. There's a lot of information there that you can go through, but if you want deeper looks into it, you can certainly click on one of these orange buttons down here, and this is going to take you into what's called our virtual brochure. Now, each one of these sections here in our virtual brochure where it talks about the opportunity, getting clients, and this is how we help you and assist you in getting clients, the training, the support, the technology, and then finally, when you've reached your decision to move forward, you certainly want to click on that last section there, which is called the final steps. Now, you'll need to check with your ABS coach that you're working with, and we'll certainly open up each one of those sections as you need them. But there you'll find all the information you're going to need about American Business Systems. Also, we are part of one of the largest independent groups of medical billers called HBMA, the Healthcare Billing and Management Association. There's a picture of their website. We're certainly a part of that. And here in the Fort Worth area with the Better Business Bureau, we have an A+ rating. So there's that on the screen, so you can go check us out there. Folks, we show us a picture of where our offices are located. You can see our address down there at 5751 Kroger Drive here in Keller, Texas. It's a little community just northwest of the Fort Worth, actually northeast of the Fort Worth area. So if you're looking to get into this business and you want to come by and visit with us, you're always welcome to schedule that. So again, check with your ABS coach that you're working with, whether it's Adam or Jason or Dirk or Alicia or myself. We would love to schedule that for you to come by and visit with us. Folks, I cannot believe that in another couple of days we are just moments away from the last month of this year and the last training workshop for 2012. Next Monday starts our training workshop for 2012. Starts on December the 3rd through the 7th. There may be a few folks on here that would like to attend, and I was just talking with Patrick just before we got started here. There are a few seats available, so please check with one of us, and we would love to help you get into this next class and get your business started, and specifically, again, on how to get doctors to outsource their billing to you. So, without further ado, let me bring Patrick Phillips on this afternoon. Patrick, it's good to have you here today. Thank you for taking out your time to help us answer some of these questions here.
Well, thank you, Eric. And people probably don't know this, of course, but we have some virtual capabilities as far as a company. And Eric is actually up in the Colorado area right now. So, Eric, thank you for taking time out of your trip up there to Colorado to see your son.
Absolutely.
He's in the service, and he's coming home.
He is coming home from Afghanistan. He's been over there for about 9 months, so we're looking forward to seeing him tomorrow.
I'll bet you are. Well, thank you for helping co-host this thing, because we've got a lot to cover today, and I'm going to go back to the title slide here just to remind people that what we're going to be talking about today is how do I get doctors to outsource their billing to me? That's the same as asking how do I get doctors to actually sign on the dotted line? How do I get clients? This is probably the most important thing that people ask us, and of course it's part of the proprietary information that we share during our week-long training down here in Dallas. So I'll be talking about this throughout the entire webinar today, and then towards the end I'm going to reveal some of the actual methods that we teach during that class, so be sure and stay with us. The billing industry, especially in healthcare, is growing, folks, according to this quote here from the U.S. Bureau of Labor Statistics, and the actual on-site jobs in the doctor's offices will be reduced because the billing is going to be outsourced. And when people hear outsourced, Eric, they usually think of something like overseas or something, huh?
That's right. Outsourcing here today is really more outside of the doctor's office. So that's what we're talking about here, about outsourcing their billing.
Yeah, because doctors are really struggling right now, folks. They have some major headaches coming with the new healthcare laws that have been passed, and so they're not really sure how to deal with those. So when we tell you and teach you for what we've learned over the last 19 years, teaching other people how to do this, this is from real life experience. This is not book learning. This is not just theory. This is the real world, and Eric is, of course, our Director of Research and Development. So, Eric, you've been out there. You know the doctors really do have a problem, don't they?
Yeah, and Patrick, last week we were in Atlanta and visiting with a group of doctors, and I can certainly tell you firsthand that the picture that we have up here on the screen is it's almost a little bit worse than what we're seeing here. I know that this is just a snapshot of something we got from the internet.
They're probably bawling, aren't they? They're crying.
They really are. It's amazing, and I'm so glad that we do what we do here with the research and development side of everything, because it gives us the pulse outside of hearing from our licensees. We certainly hear it and are hearing it directly from the doctors themselves. So I can certainly tell you, Patrick, and the rest of the group today, that there are doctors out there that are truly hurting, whether they've lost their biller in-house, whether they are worried about the what's called Obamacare or the healthcare bill,
Affordable Care Act, yeah,
right, or software. Let's just go down the list. They
got a lot of stuff they have to worry about, don't they? If they're doing the billing themselves.
That's correct. Yeah, and even if they've outsourced it too, Patrick, they've had some trouble with outsourcing their billing to other companies because of a lack of what's called, they think of transparency. But we can certainly eliminate that with our platform.
Yeah, with a web-based platform, we can let them look at the data. You can't fool them, can you? I mean, they can look at it 24/7 from any web-enabled device that's out there. So let's start with the very first reason why we think that we can help you better than anybody else that's out there, folks, get doctors to sign up with you. One of them is we help you show you how to validate that the billing is not their core competency. So, Eric, talk about that just for a moment. What is the doctor's real core competency?
Well, the doctors went to school to take care of patients. That's what they went to school for. That's their passion. And, again, it's kind of funny that we even had this up here. I had one doctor tell me just last week, he said, you know what, I didn't go to school for business. I went to school for taking care of patients. So, there is the core competency of that. That's why they hire out their accounting to their CPAs, and they've got someone else to take care of their IT stuff and,
legal matters.
Yeah. So
wash their windows.
Wash their windows. Yeah. So their core competency is medicine, Patrick. There's no doubt.
Yeah, and I think deep down inside that's what they would like to focus on, don't you, Eric? I mean, they don't really want to do all the billing to the insurance companies. It's just it's one of those have-to things. I mean, to get paid, that's what they have to do. So they don't make money doing that. They actually make their money seeing patients. So they'd rather do that, of course, and that's where their real heart's desire is, I think, to help people. And that's why we threw this quote up here from the New England Journal of Medicine, folks. Market analysts estimate that 24 cents out of every dollar are wasted on the administrative and billing expenses. So inside a doctor's office, it's just ridiculous that they would spend 24 cents out of every dollar they bring in trying to actually bring in the dollars. That's right. What they're doing by doing the billing.
Well, let
me
outsource
that to you.
Right. Well, let me ask you this, Patrick. I mean, you're the CEO, the founder of this company. You've got people that do things for you. Could you imagine you trying to bill out and invoice people. I mean, what is your time worth? I mean, just think of the doctor's time. If they had to try to keep up with everything like that, on your last screen you said 24 cents are wasted. That's probably more than that if the doctors are involved.
Oh my, yes. We don't even figure the doctor's time in those figures because what is the doctor's time worth? I don't know. Is it $400 an hour? It may be twice that, but it's a lot. So when a doctor, especially when they're smaller practices, sometimes they get involved in it and they have to deal at least with the billing during the week. If they spend just 1 hour a week, they're spending probably $1,500, $2,000 worth of their time each month dealing with something that somebody could do that much cheaper, and of course our licensees can. Well, here's another reason why and how you can get doctors to climb up. You demonstrate to them how that you can free up them and their staff to see more of those patients because, folks, it's coming. Lots coming. It's pretty quick here, right, Eric? I mean, the healthcare legislation alone is going to bring in lots and lots of new patients. And according to this quote here from the Galen Institute, this was back in 2010 even when they saw it coming. They said the challenge is getting enough primary care doctors to meet the patient demand. Can you imagine? What is it? What's the number now? 30 million uninsured Americans?
Yes, and it certainly could increase by another 5 to 10 million with some of the reports I'm hearing. So it's a big number.
And since they're predicting that there'll be a shortage of doctors, then that means the existing doctors are going to have to see that many more patients. And of course they want to because, again, as I said earlier, that's how they make their income, right? They see patients. So of course if they see more, that they'll of course earn more money. So we're just trying to help you realize, folks, that there are some real good reasons why doctors, once they're educated through things like my book that Eric mentioned earlier, those things that you have as tools as an ABS licensee will help you educate the doctor and help them realize that they shouldn't be doing the billing themselves. They should be looking at outsourcing it to somebody else. And then there's the patients.
Yeah. You got here number 3 is how help them see how you can collect more of their money owed to them by patients. Let's talk about that, Patrick. People have lost their jobs here recently. A lot of people are continuing losing their jobs or downsizing, and companies are downsizing. So let's talk a little bit how they're trying to collect money from maybe insurance companies and from their patients.
Yeah, even big hospitals are having a problem collecting the money from the patients. So you can imagine what an individual doctor's office has to do. Generally, don't they, at the end of the year, they just kind of look at that as, oh, well, I'll just write that off. I didn't collect half of what the patients owe me, so I'll just write that off. And, I mean, that's the real number according to the McKinsey & Company. I've got that quote up here on the screen now. Physicians typically collect only about 50% of the outstanding patient balances. And so $60 billion in bad debt is just written off by the doctors. And you guys can solve that problem for doctors once they realize that, and they know, right? I mean, Eric, you see when you approach a doctor's office that the biggest problem they're having right now is trying to collect from not just the insurance companies, but the patients as well.
Right. Yeah, it's getting more and more difficult collecting just from the patients. That is correct.
So with the ABS, of course, you folks will have available to you various services. We're going to talk about some of those as we go through this because when we talk about how do you get doctors to sign up, well, what if you could tell them that you could increase their receivables up to 98%? Remember that previous quote was 50% of all patient debt is written off. If you can increase that to 98% collected, that's money in the doctor's pocket, and they would rather have it in their pocket, by the way, than write it off at the end of the year, I'm sure. So these are the things that make it easy to sign up a doctor if you have these tools available to you.
Right, and don't we have one licensee that maybe is out in California that he's built pretty much his entire business off of something like what we've got here, like with Choice Pay?
Yeah, there's such a huge need that he just decided to focus on this alone, going to the doctor's offices, and boy, it's opened up all kinds of doors because I can't imagine you going to any doctor can you, Eric, that would say, oh, no, we collect all of our money from our patients? That's just not out there. It would be very rare. All right, so here's another reason why and how you will be able to sign up doctors as clients. You wake them to the fact that it costs them more to do their own billing in-house. Now, that's the bottom line, folks. For a doctor, if you could show a doctor that they're actually going to save money, do you know what it costs for a doctor and his staff to mess with the billing in their own office? Eric, I used to, now this has been years ago, when my wife was doing medical billing, I would ask a doctor, what do you think it costs you to send out an insurance claim and have it paid? And they'd go, oh, I don't know, $1 or so.
Right.
And even today, that's laughable. It's way, way more than that, but it's because they just don't consider all the hidden costs that are in there. Here's a quote, for example, from a study that was done that says it could be, with all the different things that are involved, it could be as much as $57 per claim to just file a claim. And some claims are not much more than $57, are they?
Right. And, you know, Patrick, you know, and I know you're about to get to the slide here where it's going to actually show a report here, but seeing is believing. And most doctors, and some of the feedback that I've gotten, you know, whenever people ask, well, you know, what are you going to charge? What kind of percentage are you going to charge? And you know, you certainly can't just throw out any numbers there, but, you know, doctors in their minds think that they're doing their own billing for right around 3 to 4%. And
yeah, that's right.
It's almost laughable.
Yeah, they think it really is.
The report.
Yeah, now, in fact, I'm showing this, folks, because this is one of the proprietary pieces of information and software that you get as an ABS licensee to be able to plug in the numbers from a doctor's office. So let's go down this just real slowly here so that people can wrap their brain around this. I want this to really sink in. It's got, first of all, the average number of claims filed monthly. Now, folks, that'll vary, of course, from doctor to doctor, but if the doctor's only seeing 20 patients a day, that's 100 a week. There's 400, right, per month. So we're using that as an example. And if the average amount billed for each one of those claims is only $125, it's much higher for, of course, surgeons and other specialists, but 125. Then the approximate rejection rate in a doctor's office, we've got there as 34% currently. Now, that's because we have another slide that you'll see here in just shortly that actually will give you that exact number. 34% is the average nationwide. Then we put in the hours spent doing billing. Now, that's only 40 hours a week. In other words, we're assuming there's just one person working for this doctor full-time, and that's 40 hours a week. And then the average wage paid to that person is about $14 per hour. Again, that varies from area to area, folks, but these are just, you know, it's just an example. Then don't ever write off the fact that employee benefits will add another 30% to that. So we've plugged that number in. And then I've even got in here the value of the physician's time, because we found out more and more that as licensees talk to doctors, they say, you know, I do spend some time. I haven't thought about this, but I do spend a couple of hours a week on the billing issues, talking to the office administrator and just dealing with some things about all that, meeting with her and so forth. And so at that point, folks, again, depending on what the doctor's time is worth, we plugged in here $1,600. That's only $400 a week. That's only 1 hour of a doctor's real time that they could be earning. So, of course, there's no postage or envelopes if it's all being done electronically, so I just left that blank. Then don't forget that the doctor is going to have some costs in updating their software and their hardware and doing training for new employees and even existing employees. So we've just plugged in there a $500 figure. Now, folks, in many, many, many cases, that is much, much more, especially when you figure in the IT costs, because handling a network inside of a doctor's office, you could pay one network guy $500 a month just to handle, you know, keeping all the computers running. So when it all boils down to it, this doctor in this example has a monthly billing revenue of about $33,000, bringing in those 400 claims, $125 a piece. Now, the monthly in-house cost that we figured for that person working full-time there at $14 an hour with 30% additional in benefits and vacation and so forth is going to cost about $5,000. The monthly practice revenue then, once you subtract that, is only about $27,000, almost $28,000. Now look at what it's projected when you go in as an ABS licensee. The rejection rate through our system nationwide is, what is that number right now, Eric? You remember exactly? It's less than 2%, I know.
Right. It's like 1.83 right now.
83, yeah, just under 2%. So we plugged in 2%. That means that the monthly revenue increase, just over the 34% rejection rate that they currently have, will bring in another $10,560. And so, folks, when you figure that in, and we plugged in there, by the way, you can't see this number, it's behind the scenes, but that $3,049 is based on a 7%. That's what you're charging the doctor here in this particular case. You'll be charging them a percentage of that total revenue figure up there of $27,988. So you're going to charge about $3,000, and that means that your practice revenue at this point, adding the $10,000 and subtracting the $3,000, is $40,000 for this doctor. That's an increased revenue per month, folks, of about $12,000. See the difference there between the $40,000 and the $27,000, or $150,000 a year. Now, Eric, I don't know about you, but that's a nice down payment on a car, isn't it?
It is, and again,
an Aston Martin.
Yeah. So, but these are the tools, Patrick, that are helping our licensees win the business, because seeing's believing. When we try to tell a doctor that we can get our rejection rate as low as 2%, they don't believe us with that, but that's okay. But the bigger thing is showing them, if we just did just the 6 to 7% and show them what it's really costing them to do billing in their own in-house, that's the real winner there. I think doctors just don't figure that out. Yeah,
sure. Even if it's a couple of thousand a month savings, that's better than a kick in the britches. It's better than a sharp stick with a sharp stick. And so, folks, look at that. Now, let this sink in. That's a savings for this doctor of $12,523 per month, every month. This is why it's much easier when you have these tools to sign up doctors than you would ever imagine otherwise. All right. Well, let's talk about.
I was going to say, I'm helping you out here. Help them increase their patient base and thus be able to increase their income. Because, again, Patrick, like you said earlier, there's going to be an increase of patients, but how do we reach out to and help those people get those patients in that doctor's office?
Yeah, because some doctors are struggling in their practices. They've actually seen a reduction because as insurance goes up and people have to pay for some of that themselves, they might actually start seeing the doctor less. And, of course, if a doctor has just begun their practice, they certainly need help in that area. So another service, another tool that you folks would have as an ABS licensee would be what we call AutoCard. Now, this is an online system of over 15,000 cards that are not sent electronically now. That's what's deceptive. It's online, but in this is a great system, isn't it, Eric? You literally can pick a card, postcard or greeting card, and personalize that card the way you want it to read, and send it out with the doctor's signature on it for less than you can buy that card in a store. And it's sent directly in the United States mail by postage included. So it's a great system. If a doctor doesn't have a way of maintaining his patient contact, this is a tremendous tool that you'll have. Some licensees have opened up doors talking with doctors' offices just based on this service alone. And all of these services are included in your licensing fee with American Business System, folks. So you'll have all of these tools available to you.
Right, and one of the things that we like about that system there, Patrick, is because you could, and I know we kind of talked a little bit about it in the class, but it's part about drip marketing. The doctor may not need you today, but we got to be there and just keep our name in front of the doctor, and they'll end up following.
Well, and that's a good point, Derek. I didn't even mention the fact that this is used by our licensees to actually do their marketing to the doctors themselves. We have campaigns set up so that you automatically put the doctor's name and address in, and every month that doctor gets another card from you on one of the services that you have to offer. So it's a great marketing tool for them. All right, so let's move on here to number 6. How do I get clients to sign up? Well, you educate them on the time value of money. Now, here's what I mean by that, folks. Doctors, of course, well, you would too. You'd rather have money in your bank account, right, than somebody else's, right? And so the doctor would rather have that money in their bank account available for investing or earning interest if they have it in something, rather than in the insurance company's bank accounts. Would you agree, Eric, that that would be better?
Yeah, absolutely.
Right. And that's why we show this quote here from the American Health Insurance Plans Company that basically says that 29% of the claims were received from the healthcare provider more than 30 days after the service was provided. So what does that tell you, Eric? I mean, those people that are doing in-house billing for doctors, they must be pretty busy doing some other stuff, huh? They can't even get around to filing the claim for 30 days.
One of the questions that I got asked is, you know, if someone's outsourcing, doing my billing outsourced like that, how soon after I turn in a super bill does it get processed? I couldn't believe that the doctor was even asking that question, honestly.
Yeah, they think, well, according to what my people in my own office tell me, they can't get to the claims for, 30 days. And so he thinks that that's normal. Now, folks, with our system, of course, being a web-based system, the great thing is that you'll be able to file claims, the same day. It's that real time because we use a system that we refer to this as a virtual file cabinet. So I've got a file cabinet picture here, but it's actually what they now refer to as the cloud. Yeah, it's up in the cloud. So what it's called is, we call this service iDocs Now, and this is a service that you can offer to the doctor, but you can also use it in your own billing business to secure the documents from the doctor. So when people say, well, how do you get this information from the doctor each day or each week or whatever? We go, well, used to we had to say, well, you drop by and pick it up, or you use the fax or something. Now, it's an online, secure, HIPAA-compliant system that by simply putting a small little scanner in the doctor's office, they can load in the documents that you need to do their billing each day, push a button, and boom, those documents are available online in our iDocs Now system. I mean, you have to actually see this demonstrated to really get excited about this, don't you, Eric? I mean,
right.
we bring in a scanner, and we actually show this in real time happening there in our training class down here in Dallas, and people are just like, wow, because you can search these documents by any word in the document. They're available 24/7 from any internet-connected device. Multiple people can be looking at the same document at the same time. You can print the document. You can forward it by email. And most of our licensees, of course, once they get this document on the screen, they're actually looking at it kind of like you see here illustrated on 2 different monitors. People will add another monitor, to their computer system, $150 or something nowadays. And there you have that document that the doctor sent you electronically on the screen. You have our iClaim billing system on another screen, and you're able to work without any paper at all. Paperless office, yeah. So that's how fast it is, folks, that you can get that in. And that's why the turnaround time for an insurance claim payment in an average physician's office is about 45 days. That is from the time that they submit the claim to the time that they get paid on the claim. Look at this, folks. With our web-based iClaim system, you'll be able to see claims paid in as little as 7 days. Now, I think the average, Eric, is a little more than that, right?
Right.
That's kind of like the fastest we've seen it paid is in about a week.
Yeah. So I like to say 10 to 14 days. It kind of gives a good average right there.
Yeah, but, hey, that beats 45 days, huh?
Absolutely.
So, folks, there's another tool, another service that you'll be able to offer to the doctors and that you'll be able to use in your own business to make sure that those doctors get paid as quickly as possible. That's very important to them.
I love what you say here. Shock the doctor by showing them that you get more of the money that's due them. Tell us how we can do that, Patrick.
Yeah, well, we mentioned earlier that 34% figure. Here's the actual quote for that. Industry experts have found that the average number of rejected claims for a medical practice averages about 34%. Now, if that's true, folks, and we have to go by what the American Academy of Professional Coders say about this, if that's true, by the way, some doctors is much higher than that. Eric, you've seen some doctors at 50, 60%, haven't you, in rejection?
Yes, yes.
And some of our licensees are coming back with some really amazing numbers. But if it's 34%, look at this. In our web-based real-time billing system, folks, we only have an average rejection rate of, like we said earlier, of less than 2%. Now, you do the math on that, and bottom line, that's a lot of money in a doctor's pocket, the difference between those. Then you add in the fact that 25 to 40% of all the rejection claims are never resubmitted for payment, and there's even more money there that the doctor would see at the end of the year or at the end of the month that they wouldn't see otherwise. Eric, we could tell some horror stories, couldn't we, about some offices that licensees have been in, and the office manager maybe just left, and they come in and find these claims, you know, like stacked up behind the file cabinet. They had been hiding them from the doctor.
And you know, for the spouses of those doctors, they're the ones that are going, I knew you were seeing more patients than this.
yeah, I knew you were working harder and longer than you said you were, and here's proof of it. And then, of course, folks, we've actually done, some of our licensees have sent us actual case studies. This is one from one of our licensees who ran across a doctor that was doing about 7,200 claims per year at about $125 a claim. So bottom line is, look at that line B, percentage of claims rejected. For this doctor, it was about 60% of all their claims were rejected. And of course, our licensee got that down to 2%. So if you do the math on all this, you'll see that we increased the doctor's revenue by about 41%, or over $500,000. This licensee increased the doctor's income $500,000. Now, folks, that has got to be an eye-opener for you and for, well, any doctor that realizes that we could do that type of thing for them. Now, this was an exceptionally high rejection rate. I'll admit that that's not the norm, obviously. It's 34%, we know. But it just shows that we can do some amazing things for doctors. And that's why it's much easier than you think to sign up doctors once you know this type of thing and have these kinds of tools available to you. Remember, you're a part of the nation's largest network with ABS of independent medical billers, and so you'll have all of these tools and other licensees available to you to provide this kind of thing to you. Okay, number
Patrick?
8.
Hey, Patrick, let me interject something back there on that last screen.
Sure.
You know, whenever we're telling the doctors and we're showing them, you know, these numbers here, you know, one of the biggest things that we're telling that anybody can tell a doctor, you know, I'm in business to help you collect more money for yourself. So the more money I help you, doctor, collect, the more money that I make as a billing company. So you can truly tell the doctor that it's a win-win situation, and the doctors understand that. They truly do understand that concept of business.
Yeah, good point, Eric. In other words, the people, his own staff in his own office, they don't have any motivation to get any more money in the door. The pay's the same, right? They get the same $14 an hour or whatever. With a billing service charging a percentage of the money that's actually collected, folks, there's your motivation to make sure that you get as much as you can in for that doctor.
Right.
All right, number 8. How do I get doctors to sign up? Well, you prove to the doctors that you can increase their reimbursements by making sure that they're coding correctly. Eric, talk to us a bit about codes.
Well, first of all, let me just say this as we get started. As an ABS licensee, you don't have to know anything about codes. You don't have to be a coder, because all the codes come directly from the doctor. As we see here, this is what's called a super bill, as you're looking at right here on screen, or what's called an encounter form. But there are some times where the doctors need a little bit of expertise on making sure that they are coding properly. So we have other services as an ABS licensee that can allow a licensee to get those codes done properly. So we have, the codes are broken up into 2 sections. A diagnosis code, which is what's wrong with the patient, and then you have what's called the procedure code, which is what the doctor did for the patient. So that's basically it in a nutshell. So the responsibility codes are from the doctor, and then if they need help, we've got the service to help them with code right.
Yeah, they're just numbers, but they're very important numbers because that's how the doctor gets paid. If he's choosing the wrong numbers, two things can happen. If it's a number that shouldn't be, it's like higher than it should be coding-wise, he can get in trouble with Medicare. If it's lower, then he's actually losing money. In fact, here's a quote from a fellow that says, the average physician could increase their monthly billing up to 30% if their medical coding was done accurately. Now, folks, when you think about that and realize that you will have a service called Code Right that will allow you to help the doctor improve their reimbursement rate by up to 30%, that can just blow their minds that they've been leaving money on the table because they did not know how to code accurately. You go in, and we actually are behind the scenes doing this with our certified medical coders. We'll do an analysis of that doctor's practice and provide a 20 or 30-page report to the doctor showing him or her how that they've been coding, probably in most cases undercoding because they're scared of getting slapped by Medicare. So we provide that report to them, go over it with them step by step, and help them realize that going forward, we're going to be coding it accurately. Remember, these are certified medical coders making these decisions, not you. And so they will make the right decisions for that doctor so that he can get paid accurately. Now, look what that means to a doctor. Here is where we've added a 30% to that particular instance that we saw earlier. In fact, I'll put up there the one that we just showed you. There it is, the smaller one. And there's what we just looked at. We've increased that by 30% on the average billing amount per claim that you see there. Now it's $162.50. And so bottom line, that's an increase of, let's see, 150 to 177 is about 27,000. Yeah, additional dollars for that doctor, over and above what they were. No, that's over the increase.
Over the increase, right?
Yeah, that's over the increase. Even we've added another $27,000 to that. So, folks, it's just incredible what you can do when you have the right tools, and you've associated yourself with a company that knows what they're doing. We're not fooling around, are we, Eric? We're serious about this business.
Right, and let me also interject this because I think so many people that are getting into this business, Patrick, they think, well, gosh, I'm a brand new medical billing company. How do I compete with other medical billing companies out there? Let me tell you, folks, normal medical billing companies, they don't do half of what you have here as the tools. What they've got a handful of doctors that they probably do some billing for, but they don't have a coder, or they don't have the source to do coding, as we're talking about here, to help increase these revenues. You don't have the auto card, as we mentioned earlier. You don't have these other services like the Voice Pay. Those services are just not with other medical billing companies. That's why we want to stress for you that you're more than just a medical billing company. You're a revenue cycle management company.
Yeah, and folks, think about this too. Now, this is not in the slides here, so I'm just kind of rolling off the top of my head with this, Eric, but think about starting your own medical billing company on your own, maybe scraping some things together, taking a course on the internet, reading a book, watching some videos, whatever, and you start your own company, and you don't have these tools. You're not going to be able to sign up doctors near as easily as you will be having these tools. And therefore, you will be losing way more than the $25,000 licensing fee that we charge to make these tools available to you and teach you how to use these tools. Very important that you're taught and mentored and handheld through the process of using tools like this to be able to bring you all the business you can handle. All right, number 9. Here's how you can sign up doctors. Illustrate to them how you can decrease their overhead by outsourcing their billing to you. Now, this one's very important, folks, that you realize that this is completely different from the chart we just showed you a while ago. Look at this. We've actually done an analysis for a doctor's office based similar to what we showed you earlier as far as the numbers are concerned, but we've broken it down to the full-time employees, what the doctor would be paying for paid annual leave, sick leave. You can see as you go down the list there, there's payroll taxes, there's workers' comp insurance, there's errors and omissions insurance, there's training and meeting time with those employees that you got to figure in, leave coverage, employee benefits, all of those things, and the hardware, software, and IT support, and all the other things involved in running a medical practice and doing your own billing inside, could run the doctor $46,000 a year. Now, they're not going to have any of those costs except for that 7% that you're going to charge the doctor to do the bills. And that's shown up at the top there on the right-hand column, $28,800. So compare this number, the two numbers there, and I don't know what the difference is there, but it's a lot. It's 37% cheaper for the doctor to outsource just based on his actual costs. And,
yeah, I think that's $17,000 difference.
Yeah, that's right. I had a slide on that. I forgot I did the math on that. But that's why this doctor here is so happy. She is saving $17,000, folks, by just outsourcing the thing that she doesn't even want to mess with anyway. They want to get this outside their office. They just haven't found somebody that they can trust. You mentioned earlier, Eric, the fact that doctors don't feel comfortable outsourcing because they feel like they lose control over the billing. But with our system, of course, being a web-based system, they can still look at the status of their claims 24/7 from their iPhone if they want to, or an Android phone.
That's the biggest thing. Absolutely.
All right. Did I skip a 10 in there?
You know, I'm looking at our slide. I think you did. So this is
all right. So this is number 10. Here's how you sign up doctors, folks. You show doctors how they can receive up to $39,000 from the government for what the government defines as meaningful use of an electronic medical record system. Eric, you want to talk to them just a bit about that? What does that mean? Yeah. A doctor, $39,000.
That means that they have got to be, well, first of all, the government is helping doctors get into electronic medical records or electronic health records. There are platforms out there that can cost the doctors well into the $50,000 to $60,000 to $70,000 range, if not higher. So the government has said, look, if you'll start using the system and using it within what's called the terms of meaningful use definitions, we'll give you X amount of dollars. And so that's what the doctors are being able to collect with. Well, the great thing about our system, our EMRX system, it certainly doesn't cost the doctor thousands of dollars or really even hundreds of dollars. But they can still get the access and get that money. We can show them how to get that extra $39,000 into their pocket.
That's right. Our system has been what they call certified by the government for the meaningful use money, the stimulus money that's due to the doctors. And we've actually seen checks actually issued to the doctors using our system. So we know that it's certified for getting that stimulus money from the doctor. And folks, it means basically really $39,000 to any doctor is worth getting involved in electronic records, especially because if they don't, Eric, they start getting fined here in a few years, don't they?
They will. They'll start getting fined on top of that.
Yeah. So they might as well just get involved as quick as they can.
Correct.
Okay. This is actually 11. And the last one, and that is, folks, you can sign up doctors by getting past the gatekeepers by talking about anything but their billing. Now, Eric, you've approached doctors, and some doctors have been approached by other medical billers, and they think their billing is under control, don't they? They think they got it all in hand.
Yeah, you know, I like to tell this story, Patrick. It's kind of like if you and I just met today, and I would ask you, hey, Patrick, how's your family? You'd say, oh, my family's doing fine. But if I were to ask you, and you and I have known each other for as long as you and I have known each other now, for over 5 years, if I were to say, how's your family, you might tell me, oh, man, it's really not doing well. Why is that? Because there's a trust factor. There's been some things that have been there. That's the issue that I think doctors are faced with. They just don't want to just come out and say, oh, my billing's terrible. That's why we've got all of the tricks to get past that area.
Yeah, and in many cases, they really do think that their billing is under control. So
they do.
We teach our licensees, folks, to go in as medical revenue cycle managers. In other words, you're going to manage the entire revenue cycle, illustrated by this illustration here. And we'll go into more detail, of course, in the actual workshop about this. But you'll wrap your brain around this real easy. there's 6 areas that the doctor has to be concerned about to get all the money that's due them. And you can help them get every single cent that's actually due to them and increase their revenue by becoming that manager, not just going in and saying, I can help you with your medical billing. That's not what they want to hear. And in many cases, they'll say, hey, it's fine. You know, don't worry about me. That's why we illustrate on our website with all these little boxes here, folks, all the things that we've been talking about today. These are the tools that help you open the doors to get in and talk with the doctor. Don't talk to them about their billing. Talk to them about their patient receivables. Talk to them about the past due that they have out there that you can help them collect with Quick Collect. Talk to them about maintaining their current patient base with AutoCard. Talk to them about getting all their documents online electronically with iDocs Now. Talk to them about protecting them against the Medicare audits that are going on right now with Audit Guard. And, of course, we mentioned CodeRide earlier to help them get their coding in place. All of these things are very important for us, folks. The Audit Guard, for example, is a very important thing to help the doctors feel comfortable that if Medicare walked into a doctor's office and finds some things wrong, Eric, what are some of the fines that you've heard from Medicare on doctors being non-compliant?
Well, for one example, if they're not compliant, if they have received money from Medicare on the meaningful use, if they don't have certain documents on there, they could be fined up to $50,000 per incident.
Wow. Yeah, and so, folks, Audit Guard, again, we're doing this behind the scenes for you. You're just offering it through the doctor, and you're making money on it, of course. And I mean, real good money. We've had licensees make $1,000 plus on each one of these audits that we do. But we come back with a report to the doctor showing them and helping them feel comfortable that they can get ready in case Medicare does show up. And, Eric, it's just a matter of time that they will show up for a doctor, won't they?
Correct. That's a matter of time.
So, again, we're going back to this point. Talk to them about anything but their billing, and you'll have a door open to you that you wouldn't have otherwise. And you'll also make money on the service that you're offering. But it also gets you in the door. You've solved one of their problems. Hey, when something does go awry with their medical billing or one of their employees quits or whatever, you'll be there. And we'll teach you how to follow up to make sure that you're there so they select you for their medical biller. Then there's Quick Collect. I mentioned that just briefly a while ago because there's lots of money out there that patients owe to doctors that they've not been able to collect. I'm talking about past due money now. And we can go in and actually collect that and still make the patients want to be a patient of the doctor. It's not a collection agency. You're not calling up little Mrs. Jones and saying, hey, where's that $20 you owe to Dr. Smith? But it's a very valuable service, and you can make money on that as well. Now, folks, we're kind of wrapping up here. Eric, I'd like to open it up, if we could, and see if there's any questions that people want to type into the question box there over on the right-hand side. You can just type that in, folks. While they do that, I want to mention the ways that we actually teach in that training class here in Dallas to actually help you get those clients. Now, folks, some of these may not mean anything to you. Others, you may think you know what direct mail is or, social media and so forth, but not the way we teach it, not the way we've designed it for the medical billing industry. For example, one of the things we mentioned there is internet and websites. We're going to teach you and give you, as a part of your license fee, a website that's professionally designed and that has all the verbiage that's correct for all of your services already made. Eric, this could cost people $2,500 to $3,000 easily. And we give that to you as a part of your license fee, folks, because it's very important that in today's world you have a presence out there on the internet. We'll teach you how important that is during the training class and even mention some things about search engine optimization and things that will help you build your business. You saw on that list previously that we talk about direct mail. This is one of our direct mail campaigns that you will be taught how to implement this and do your marketing through direct mail if that's the way you want to go. Again, folks, out of that list of stuff that we just showed you, there's probably 12 different ways to market these services, and each one of them uniquely designed for the medical claims business. Business networking and your warm market, very important that you learn exactly how to say the right things to people when you go to business networking meetings. We'll show you where to find those meetings, how to get engaged with those people, what to say when you get there, and how to start making the connections that will lead to clients. We'll even teach you about educational events like seminars and lunch and learns that you can actually give with using PowerPoints that we have available to teach people more about cash flow in a doctor's office, and of course open up many, many doors for you that you wouldn't have earlier. Imagine standing in front of a group of people like this is one of our actual licensees, by the way, sent us this picture, and having 20 or 30 office managers or doctors sitting there listening to what you have to say will help you position yourself, folks, as the expert. And then, of course, there's trade shows. Eric, you know a lot about that, huh? Here recently, Eric has done some research for us in the trade show arena and found out that, well, Eric, you came back with, you said a lot of leads, huh?
A lot of leads. Yep, and you have to be. Yep, and we certainly talk about that in class.
Yeah, we go into detail in exactly how to find these places. We have displays that we already have pre-designed that are available for you to rent from us. I'll show you a picture of them here in just a moment, and you'll be able to do those trade shows. Then, of course, if you don't want to do any marketing at all, or maybe you just are restricted in your time and don't have time to do it, we'll show you even how to find commissioned sales reps, people who can go out and get the clients for you, and you don't pay them anything until they bring you a signed contract. That's commission only, it's called. We also have, of course, all of the brochures that are professionally designed that make you look like a real large company, not just somebody working out of their spare bedroom. We have presentation folders and show you how to put together proposals and pricing to make sure that you don't leave money on the table. We also have, of course, the book available that I wrote called Cash Crunch to Cash Flow that, as Eric said, is a marketing tool in and of itself to educate the doctors. We have a DVD that has testimonials from 5 doctors and me, and is hosted by Hugh Downs of 2020 fame. These DVDs were developed so that you have a tool, folks, to let the doctors hear from their own peers as to why they've decided to outsource. There's the trade show display that I mentioned earlier. That's Rhodey, a lady that works there in our office, standing in front of that. As you can see, it's a big 10 by 10 display that you can use for those trade shows. So I wanted to just kind of briefly show you folks that during that week's training we have a lot to cover.
All right, you want to get to some questions, Patrick?
Yeah, let's go.
All right, Bob asked a question. Do you have to have a college degree to get into this business?
You know what? I don't know of many people who've come through our training that claim that they have any kind of a degree, and most of them that do are doing something else besides what the degree was for. So no, the only education you need is what we give you in our training package. Now the package includes, of course, some home study materials, hours and hours of video training that's out there on our licensee support website, and then, of course, the week-long training that you'll have here in Dallas. You'll see there in the picture, for example, that's on your screen, that we do bring in laptops, and for, what, about a day and a half there, isn't it, Eric? A full day and a half, we're actually letting people process claims, put in patient information, and work with the electronic medical records, and they learn all they need to know about our system right there in that week's training. So no educational degrees or background needed besides what we give you.
Yeah, and let me go on a little bit further. You don't even need because a lot of people do ask us, Patrick, about a medical billing certificate or degree or anything else like that. You don't even need that.
No. In fact, we issue a certificate at the end of the week that says you are a certified medical revenue specialist, meaning you have the ability to help that doctor with their medical revenue cycle.
Right.
So it's all you need, folks, to do medical billing. There's no licensing or certification by any state or federal government other than what we give you. You're ready to go and hit the ground. And, well, if you talk to some of our existing licensees, you'll find out that they are hitting the ground pretty fast and building their businesses pretty quickly.
All right. I hope I've got the names pronounced here. Norwinder is asking the question about what would be my competition and where can I find more information on it so I know what I'm up against. So let's talk a little bit about that competition portion of it, Patrick.
Yeah, really your biggest competition, of course, to start with, is the doctor's office themselves. Overcoming some of the things that you've heard me talk about today. This is really important that you realize that they are your competition because they're doing their own billing, right? If they're not, they've already outsourced it to somebody else in the community, then you will have to find out, of course, who your local competition is that's out there. We can show you how to find those people that are out there. It's pretty simple to find other medical billers. As far as the ABS licensees, folks, we don't have any area of the country where we have so many licensees that they run into one another. In fact, in one major city we have like 5, don't we, Eric? And they've never run across one another. So
right.
There's just too many doctors out there in any given area, folks, for you to ever worry about the competition.
Yeah, competition, again, is not that, let's put it this way, whether the doctors are doing it in-house or outsourcing it, the doctors are doing billing. Yeah. That's why we're able to, with the different services, be able to help you get into those doctors' offices a little bit quicker. Okay, looks like Martha is asking the question about what other types of services do we offer just to regular businesses?
Oh, that's a great question, because sometimes we don't even think about mentioning that, Eric, but some of the services that we just talked about can actually be offered to other types of businesses. Let's take iDocs Now, for example. Folks, that is a online document management system. Any business that's out there or educational institution that deals in lots of paper and wants to make that available electronically now to all their people, can turn all their paper into electronic documents with that one service. And we've got licensees who've actually aimed that at things like finance companies, mortgage companies, insurance companies, schools of all kinds and trade schools, because there's lots of paper involved in those. So we'll go into that in detail. That's one of the services. We also have the Quick Collect service, which is also a way to any business that has past due accounts, we can go help them collect that money and do it better than any collection agency that's out there. So there's actually several of our services that can be used that way. Great question.
There you go. Absolutely. That is a great question. Clint's asking the question of, he says, are you guys just gearing more towards PCPs, which is just more of the regular
primary care
physicians, or what about subspecialties? I mean, let's talk about all the specialties we can do billing for, Patrick.
Oh, my goodness. If you went out and Googled physician specialties, you would come up with what, Eric? 2 dozen at least? Maybe 3 dozen different specialties?
More than that. Yeah, absolutely.
Yeah. And so anybody who's filing currently insurance claims through what's called the HCFA 1500 form, now it's called the CMS form. Anyway, it's a standardized form that all insurance companies and Medicare have approved as this is what we need to file an insurance claim. You can file their claims for them, and that includes just about every specialty that's out there, except for hospital claims is a completely different creature, and so are dental claims. We even have ways that you can actually file those claims as well, but it's not your target market. There's too many doctors out there and specialties that you can aim for. So, no, it's not just the primary care doctors. It's all the specialties that are out there.
All the specialties. Okay, looks like we've got from Steve. Steve is asking a question about, is there any recurring fees to ABS?
Yes, Steve. Now, there's no other, besides the licensing fee, there's no royalties, there's no monthly payments of any kind. The only way licensees are paying something to ABS is through the processing of the claims. For example, we get rebates from our clearinghouse on all the claims that are sent through them. So we get a few pennies on each one of those claims. You're not paying that. The technology partner that we've hooked up with and the clearinghouses have actually decided to pay us because we bring them so much volume. So you're not actually paying anything to ABS on a regular basis at all. No, there's no royalties like there are with franchises.
Patrick, let's do one more question, and we'll have to wrap this up. And I love this question from Richard. He asked, what types of things can cause claims to be rejected besides wrong coding? I would like to try to answer that one for us real quickly. One way that claims could get rejected is simply because a name has been typed in incorrectly. And our system actually, through the online eligibility, can literally pull all that information from the insurance company and populated into the system without anybody having to type that out. So that's one way a claim can be rejected without just besides wrong coding.
Yeah, actually, there's several things that we'll go over in the workshop as to why those claims can be rejected. But, boy, the insurance company is looking for any excuse not to pay that claim, folks. They'll do anything. They've rejected it for the least little bitty things. And sometimes you can send that claim through 2 or 3 times, and it gets rejected each time if you don't have the right real-time error checking that's built into our system.
Well, Patrick, it is a little bit after 4 o'clock our time. We've got our class that's coming up next week, which is December the 3rd through the 7th. Here are our instructors that are going to be there this next week. Cynthia, Tierney, and Bonnie, all of these ladies are running full-time medical billing businesses.
Yeah, they are ABS licensees, just like you will be once you've gone through our training. They've gone through the training. They've done the due diligence that you are now doing on us as a company. And you'll be able to meet with and bond with and start networking with these ladies that are going to actually be teaching the class, and, of course, the other 10, 20 people that are in the class with you as well. So great time of the year to get down here. We don't normally bring down 3 instructors, but this is one of those times at the end of the year that I like to bring 3 people in that are doing the business, and you'll be able to grill them all you want on how this business is working for them. Also, I wanted to show the money-back guarantee. Eric, you want to tell them about that?
Absolutely. Patrick, this is one of the things that it does so well with, and that is if for any reason at the end of the training workshop that you just don't feel like this business is right for you, just simply tell one of us, and we will arrange for you to receive a full refund of your licensing fee. Folks, you can't get any better than this. Sit through an entire week of class, hear all of our proprietary information that we do have with all the different tools, and then still get your money back if you feel like this is not for you. So, Patrick, that's a great thing to offer folks.
Well, we just think that that's the way we would want to be dealt with in business. It's the fair way to do it because you don't really know what you have on some new business opportunity like this unless you've sat through and learned all that. So, that has happened to us, about 3 times, I think, in the last 19 years. So there's usually a very special reason why personal things come up during the week and so forth. But we've never had anybody say that this wasn't what they thought it was going to be. It really is much, much more. In fact, at the end of the week, we do testimonials. If you haven't seen some of those out there on our YouTube channel, go to our website and look up under News and go to the YouTube channel and watch some of those testimonials. You'll see that people are pretty amazed by what they get there at the end of the week. Well, Eric, thank you for taking time out of your little trip up there to Colorado to co-host this for us. I appreciate you doing that.
Absolutely. My